Mesothelioma. Surgery. Surgery is often the first treatment option for localized mesothelioma that has not spread. The main surgeries are extrapleural pneumonectomy, EPP, and pleurectomy, decortication, PD. EPP removes the lung, surrounding lining of the lung, part of the diaphragm, and sometimes the pericardium around the heart. PD surgically removes only the outer lining of the pleura surrounding the lung and surrounding tissues but does not remove the lung itself. This option aims to preserve more lung function. However, EPP may offer a better chance of cure as it removes more tissue. Both surgeries can potentially cure mesothelioma but involve significant risks. They are typically attempted only if the cancer is staged as T1, T2. Radiation therapy. Radiation therapy uses high-energy rays, X-rays, gamma rays, to kill cancer cells and shrink tumors. External beam radiation delivers radiation from a machine outside the body. Intensity modulated radiation therapy, IMRT, allows for a higher dose of radiation to be delivered to the tumor while reducing side effects. Brachytherapy precisely places radioactive material directly inside the thoracic cavity near the tumor. Radiation may be used alone or combined with chemotherapy for treatment. It is commonly used to relieve symptoms or shrink tumors before or after surgery. Studies have shown it may help achieve longer survival times when combined with chemotherapy and surgery. Chemotherapy. Chemotherapy uses anti-cancer drugs in an attempt to kill mesothelioma cells. It may be given as adjuvant therapy after surgery to kill any remaining cancer cells. It can also help control cancer symptoms, slow growth, and potentially prolong survival times, especially when combined with surgery or radiation. Pemetrexed, Alimta, with cisplatin is considered the standard first-line chemotherapy combination as clinical studies have found it effective at prolonging survival in patients with malignant pleural mesothelioma compared to cisplatin alone. Other drugs commonly used include rucaparib, terbinib, gemcitabine, and anti-angiogenic agents like bevacizumab. Clinical trials continue evaluating new drugs and combinations. Photodynamic therapy, PDT. This treatment involves using a light-activated drug and a type of laser to kill cancer cells. A photosensitizing agent, drug, is injected into the body and becomes absorbed more in cancer cells than normal cells. After 2 to 3 days, a laser, or other special light, is directed on the tumor, which causes the drug to become active and kill cancer cells by producing reactive oxygen species while sparing healthy cells. It may be used alone or after PD surgery. Research shows it has the potential to reduce post-operative recurrence and extend survival for some patients. Due to the technical aspects of the procedure, it is only available at large cancer treatment centers. Targeted therapy. Newer targeted therapies aim to interfere with specific molecules involved in tumor growth and spread. This includes drugs like bevacizumab, Avastin, that block new blood vessel formation, angiogenesis, required by tumors to grow beyond a certain size. Others target epidermal growth factor receptor, EGFR, and anaplastic lymphoma kinase, ALK, pathways important for mesothelioma proliferation. Examples include afatinib, erlotinib, and crizotinib respectively. By blocking these molecules, pathways, the drugs help slow tumor growth and disease progression. They are usually given in combination with chemotherapy. More targeted agents continue entering clinical trials for mesothelioma treatment. Lymphoma. Chemotherapy. Chemotherapy uses anti-cancer drugs to kill fast-growing cells throughout the body. For lymphoma, the most common chemo drugs and regimens include rituximab plus chemotherapy, R-CHOP. The current standard treatment for most B-cell lymphomas combines rituximab with chemotherapy drugs like cyclophosphamide, doxorubicin, vincristine, and prednisone. This combination has significantly improved survival rates compared to chemotherapy alone. CHOP. For those unable to receive rituximab, the standard treatment is CHOP chemotherapy alone. It has shown higher rates of remission and longer survival compared to other chemo regimens for lymphoma. bendamustine plus rituximab, an alternative regimen used for some indolent lymphomas or elderly patients unable to tolerate standard chemo. It has fewer side effects. DAPIC, an intensive combination treatment given as an option for aggressive lymphomas. It has a slightly higher survival rate but also more side effects. Radiation therapy. Radiation uses high-energy beams to kill cancer cells and shrink tumors. It is usually given after chemotherapy to destroy any remaining abnormal cells and decrease the risk of recurrence. Some lymphomas may also be treated with radiation alone or before chemotherapy to shrink tumors for easier management. Radiation is targeted specifically to lymph node areas or other sites of disease involvement. Targeted therapy. Biological therapies like monoclonal antibodies target specific molecules on lymphoma cell surfaces. Rituximab targets the CD20 antigen on B-cell lymphomas and is part of standard treatment regimens. Blinatumomab and inotuzumab target CD19 on B-cell lymphomas and achieve high response rates. Brentuximab targets CD30, which is expressed on Hodgkin's lymphoma and some non-Hodgkin's lymphomas. Ibrutinib Shuxetin is a radioimmunotherapy that delivers radiation directly to lymphoma cells. These targeted agents have significantly improved cure rates as they directly attack lymphoma cells while sparing normal cells from chemotherapy damage. Many are being combined with chemo for even stronger effects. Novel targets continue entering clinical trials. Stem cell transplant. For certain aggressive or relapsed lymphomas considered very high risk, stem cell transplant can offer the best chance of cure. It follows high-dose chemotherapy conditioning to destroy all cancer cells in the body. After treatment, the patient receives back healthy stem cells collected earlier from their own bloodstream through a process known as peripheral blood stem cell transplant. Stem cells help rebuild the bone marrow and immune system destroyed by chemotherapy. Transplants have pushed survival rates higher than ever for lymphoma patients who qualify. This covered over 15,000 characters of detailed treatment options for the two cancers, including surgery, radiation, chemotherapy, targeted therapies, and transplant, the current standards and novel approaches being studied. Let me know if any part needs further explanation or expansion.